there is no difference between the two parties going into this election in terms of that public hospital or spending.
In the Medicare debate in the past 24 hours, the Albanese Government has moved to stabilise the essential idea behind Medicare, the system Labor introduced 41 years ago, that you can visit a GP without having to pay up front. But equally important to Labor is the political target, Peter Dutton's credibility. Let's fast forward from Mr Dutton's 2013 speech to the National Press Club to the 2014 budget.
The Medical Research Future Fund will receive all the savings from the introduction of a $7 Medicare co-contribution, modest changes to the pharmaceutical benefits scheme and other responsible changes in the health budget.
Contrary to Dutton's 2013 speech, Joe Hockey's budget included a planned $50 billion cut to public hospitals, among those other responsible changes he mentioned in the budget speech. And that $7 Medicare co-contribution, requiring everyone to pay $7 up front to visit the doctor, was one of the absolute political howlers of the 2014 budget.
We've put in place a proposal that charges a modest co-payment, but it also retains bulk billing to protect those who are not able to pay the $7.
The idea didn't last very long.
The co-payment is dead, buried and cremated.
You may have been hearing Peter Dutton's name in the past couple of days as much as you have been hearing details of Labor's plan to spend an extra $8.5 billion on boosting bulk billing rates. That's because this policy, and the decision to announce it before the campaign proper begins, is at the centre of Labor's fight back against the opposition leader's recent polling ascendancy over the Prime Minister.
Peter Dutton tried to abolish bulk billing. He tried to cut $50 billion from hospitals. He tried to make people pay a fee when they went to the emergency departments.
Peter Dutton was front and centre and was the health minister, and was so bad that doctors voted him the worst health minister in their history.
The government is proposing to spread the incentive payment that GPs receive for bulk billing to all Australians, not just the concession card holders and families with children originally covered in a 2023 announcement.
So now GPs will get that incentive every time they bulk bill any of their patients instead of that narrower group. So that will make a big difference to the money flowing to GP clinics.
There are significant differences in the business models of GP practices, from small practices that don't bulk bill to those that bulk bill everything. And there are differences between the city and the bush.
Rural doctors know their communities well, the patients that need to be bulk billed, whether they're concession card holders or the children under 16 that are eligible for that incentive, but also people that weren't eligible for the incentive.
The government is also offering a further incentive payment to GP practices which commit to doing 100% bulk billing, but it's not yet clear how that will affect different practices.
And at the moment, we're not 100% confident that that will, be applicable for all rural and remote general practices. We really need each practice to look at their profile of patients, look at the types of work that they're doing, because what we don't want to do is, with this 12.5%, see practices close their doors because they can't afford to continue to be, opening their doors and providing the breadth of services they currently do.
The reaction to the government's announcement has generally been good. Even Peter Dutton was quick to adopt the policy yesterday, which he said would be funded by cuts to the public service.
I'm pleased to announce today the Coalition Government is committed to $9 billion worth of investment into our general practice network.
The opposition leader's move to immediately match the Labor policy shows the Coalition's sensitivity to attacks on its record on health. Labor mounted an attack on the Coalition in 2016 over what it claimed the Turnbull government planned to do. This time it is focused on what the Coalition actually did in office. Of course, there's not much point getting greater access to bulk billing if you can't see your GP because of long waiting lists. There's money to address that problem too, in what is now a bipartisan policy committing to 400 extra nursing scholarships and training for 2,000 new GPs a year by 2028.
They're projecting record numbers of GP graduates, and over time you would expect that, could reduce waiting times, particularly in those parts of Australia where there are enough GPs to go around. It's not clear that more GPs will go to the areas that they're needed most, those GP deserts that have persisted in Australia for decades.
Despite the new spending being welcomed as stabilising the system, almost everyone agrees that much bigger changes need to be made that reflect the changing health needs of the population.
There are actually deeper problems in general practice that are about, how teams are configured, how practices are paid. Currently, Australia is quite unusual around the world with our overwhelming reliance on fee-for-service payments, meaning every time you get a treatment or an intervention, there's a fee for that. And that's really not a good fit with our current health needs. But now we see this really rapid rise in complex chronic disease where people have to manage conditions over decades.
A lot of rural general practices don't just do attendance-based type consultations. They've got a much broader scope of practice, a much broader scope of services that they provide. So we really need to look at what it costs for a practice just to open its doors every day with, a practice manager, administration staff, having a good, highly qualified practice nurse and really good GPs.
The question is whether we will hear more detailed proposals from either side of politics about what they will do about these problems, or just point scoring about their opponents' policy records.